Hey everyone, this is Richie from PTDude.com. Thank you for joining me for episode 3 of PTDude.com's video series called Ask a PT. One of the most commonly asked questions that I get as a physical therapist is, should I ice or should I heat? Well, sadly, there's not a universal answer for that question as it depends on a couple of factors. Today, I'd like to help you understand how I answer this question to my patients in practice. Let's begin by talking about how ice and heat work to decrease your pain. They both work on the same pain relief theory called the Gait Control theory. To help you understand the Gait Control theory, we're going to review the nerves and how they transport their signal through them. We're going to talk about the nerve fibers, and then we're going to also talk about how the whole theory works in general. We are going to begin with a basic understanding of the nerves. The nerves are basically the body's wiring system. They carry action potentials that transmit information much like a wire carries electricity. Generally, they will carry information to the brain or away from the brain. They do that through electrochemical interactions. This diagram is a very basic diagram to highlight the important aspects of the nerve that will be relevant to the gait control theory and what affects the speed of the action potential traveling through the nerves. This right here is the axon of the nerve, and these are the myelin sheaths that wrap around the nerve. When the action potential travels through the axon, it will speed up in these areas of the myelin, essentially making the action potential jump through the nerve. Therefore, a myelinated nerve will send their signals faster than a nerve that is not myelinated. The diameter of the nerve will also affect the speed of the signal. A larger diameter nerve will allow the action potential to travel faster than a smaller diameter nerve. Here we have 3 different types of nerve fibers that all have a role to play in the gait control theory. On the left side, we have the A-beta fibers. These are the fibers that will carry sensory information as in temperature, sensation, or even the sensation you feel with electrical stimulation, which can also be known as a TENS unit. They have a medium diameter and are myelinated. Therefore, they have a fast signal speed going through the nerve. The fibers on the right side of your screen are your A-delta fibers and your C fibers. Both of these fibers will carry pain signals. They are both small in diameter, the main difference being that the A-delta fibers are myelinated, where the C fibers are not myelinated. Therefore, they will both have a slower travel speed than the A-beta fibers. Now that we have a basic understanding of the nerves and a few of the types of nerves, let's talk more specifically about the gait control theory. You are probably looking at this picture thinking, that looks like a bunch of cars trying to park in a parking lot. But have you ever tried to turn left onto a very busy road? Well then, you would know that this is a lot harder to turn left onto the busy road. This is sort of the same situation with the gait control theory. For this example, we will say that all the blue cars on the busy road are your sensory inputs, they're the A-beta fibers, and the red cars trying to turn left are the pain inputs through the C and A-delta fibers. And the C fibers here will be represented as a dirt road because they are slower than the other two. The A-delta fibers here will be represented as a small asphalt road in the picture. Now this road that they are turning onto will lead to a parking lot that all the cars want to go to. The problem is that there are only a limited number of parking spots. The majority of these parking spots will be taken by the sensory inputs due to the higher number of sensory cars getting through compared to the pain cars trying to turn onto the busy road. So the parking lot in the previous picture is to a transit center that will take the occupants of the parking lot to the brain. In this case, it will be the sensory signals that will be sent to the brain, effectively decreasing the amount of pain signals that get to the brain. In theory, this will decrease your pain. This is why heat, ice, electrical stimulation, etc. are effective pain modulators. Now the next question that I usually get is, if they work in the same way, why can't I just use either of them? Well, to answer that question, we need to further discuss on how ice and heat work. Ice will generally close everything down, which decreases your blood flow, which will also decrease the rate of swelling and possibly even reduce the swelling. Heat will open everything up, bringing blood flow and swelling to the area. In an acute injury, an injury that's under a month old, I will generally tell my patients to use ice to control their swelling. Now, if the injury is older than a month and there is no swelling to be concerned about, I usually tell them that heat or ice will be fine, whatever feels better for them. Now for stiff muscles, I generally prefer to use heat. After a workout, I generally prefer to use ice. Those are just some of the factors that go into my decision making on whether to use ice or heat for my patients. Obviously, it depends on what's going on and how they're presenting to me. Thank you for watching my video. I hope you enjoyed it. Please hit the subscribe button so you don't miss out on future videos.